In a 1 minute soundbite, you're working on the message. Talking to the 300 million Americans out there, what is the message?
Well, see, you don't work on a message for 300 million people to begin with. You work on a message tailored for your particular audience. Namely, you're talking to people in Portland, Oregon, or you're talking to people in the labor movement, or you're talking to church people, like in Detroit, the Council of Baptist Pastors, or you're talking to the National Lawyers Association of African American members of the bar, and the messaging, and we're getting more adept at this, is critical because some language, especially medical terminology, is either misunderstood or not understood at all. And so it might be assumed that everybody knows what you're saying, but a lot of people are loath to get up and say, what did you mean by a medical term that we assume that everyone would know about? So the messaging, we've just come from the Progressive Caucus. When I flew here, I flew in from Virginia, where we had a one-day Progressive Caucus, and messaging was very big in terms of how progressives talk to people, and that's very much on my mind as we examine how we respond to people about a universal health care system, particularly when there is a corporate buildup, a health insurance body that's well-funded. They have plenty of consultants. They can spend. They have overarching influence with the media in general. So it's very much in the front of my understanding that how you say it. And as a matter of fact, that's why we've taken single payer out of the title of H.R. 676. And we've changed the name from the National Health Care Bill to something that we consider more meaningful, namely a revised Medicare bill. And it's these kinds of nuance that doesn't change a thing, but it's received differently because of the particular language, replacement language we've selected.
How do you talk to the Tea Party?
Well, right now I'm talking to them one by one. And I'm not. I'm feeling my way. I wish I had a nice pat strategy for them, but I'm trying to view them by giving them the benefit of the doubt. And I'll tell you when I first started thinking about that. When we were doing healthcare reform, we were bombarded. The Capitol Hill police were overwhelmed. There were tens of thousands of people storming around with signs. Remember that the health care is unconstitutional, that it's socialism, that it's big government, and people were screaming and cursing and threatening members of Congress quite openly. And after we passed the bill, I began to realize that there were benefits in the bill that could be helping more than half of the people that were screaming at me. And when we started testing it out on individual issues, it became clear that we were right. For example, for parents to be able to keep their youngsters in their insurance policy for 7 years longer than the present law at that time provided, I mean, who wouldn't want that? And when we tested it, people said, I want that. And I think to myself, I wonder how many people out there yelling and screaming would really be opposed to this bill if they knew the provision was in it. Remember, the bill was over 1,300 pages. So members hadn't read the bill. We'd still be reading 10 pages a day now. But then another thing occurred to me. Pre-existing conditions was no longer a cause for either being denied health insurance or being eliminated from your insurance program for that reason. I wondered how many of those people out there would be beneficiaries of this provision, and how many even knew that it was being added to protect them. And so we go on and on down the list. It became clear to me that these people, and I won't say that all of them were Tea Party activists. I think many of them were just people that had been riled up about the allegations made against the bill, but that they were disturbed about the rising costs of health insurance, the arbitrary way that health insurance companies can raise anybody's premiums, how they were increasing the list of co-payments every time they negotiated their health care, and they couldn't even get a public option in the bill, even after the president claimed that he was for it. They were angry about certain specific things of which I sympathize with them about. But they were angry at me for things that we improved that we didn't successfully communicate to them. And so here's a perfect example of people irritated but at the wrong people about things that they were not aware of.
In light of single payer, how do you see supporting Obama's bill as a step towards single payer?
Because the improvements that are included in the Obama bill will now be a stepping stone that we can go further toward our bill. So what would have been a real setback from my perspective is, and it's easy to line up the things you don't like about healthcare reform, the things you do, and and one could come to the conclusion, well, these things I don't like about it outweigh the things that I'll concede were beneficial. So therefore, we would be better off with no bill. But that's an academic analysis. Politically, if we got no bill and the Republicans came in and took over the Congress, which they did, we would be set back. We know we're not going to get anywhere. So it would have made things much worse and much more difficult for universal health care or revised and improved Medicare.
One of the things that people are concerned about is the fact that we've locked in the insurance companies in Obama's bill. How would you undo that towards single payer?
Because a single payer would eliminate the 1,300 insurance companies and the incredible number of provisions that come off that. One of the big costs is the fact that administrative costs, filling out the forms, are driving some physicians out of private practice because the paperwork is so incredible. And so much to everybody's relief, we would have only one payer, and we leave it intentionally open for resolution. It could be one government payer. It could be, on the other hand, one private insurance payer. It could be Blue Cross Blue Shield, or it could be a combination of existing insurance companies, but it would only be one. And so this is a huge step forward and a great relief for all the healthcare organizations that feel that they're being burdened by this excessive amount of paperwork.
But for all the healthcare companies out there, the insurance companies out there, single payer is going to eliminate some of them. And they've got the $1 billion lobby. How do you overcome that $1 billion lobby and all the health insurance companies who are now locked into a system where people have to buy insurance? How do you undo that? How do you take them out of the picture?
Well, the bill would take them out of the picture because it would only, that if the bill passed, they would be out of the picture. But the question is, how do we get the votes to take them out of the picture? And the way we get the votes to take them out of the picture is exactly what's been going on here in Oregon at this very important conference, is that we're beginning to examine how you get people to either encourage the development of a state single payer, of which 20 or 21 states are already looking at, or how we continue to build support for a national bill. And the way we take them out is that money can't vote, lobbyists can't vote, and only with organized, committed, relentless campaigning at the grassroots level will we be able to take them out. And that's not to make this sound like something that can be done easily. It's going to be tough, but we don't have any illusions about the fact that these folks are financed and that they're clever and they're reluctant, they're loath to give up the fortunes that they're earning. They're not going to sit down and negotiate away all the profits they've enjoyed up till now. We know that. But look at the challenge that King faced. You know, the civil rights movement is the best example. We're not risking our lives by supporting universal health care, or we're not endangering our families, or we're not going to incur the wrath of the police or the prosecutors or the court system. So actually, because I've had some contact with the civil rights movement and Dr. King and Abernathy and Andrew Young and Walter Fauntleroy and all of those brilliant, those were courageous decisions, which, by the way, were supported by hordes of young people that knew full well what they were getting into. I didn't mention John Lewis, who was almost beaten to death on the bus and at Selma. So this is easy. I don't worry about my life being in danger because the government doesn't want this to happen. Many times in the South, the people that wore uniforms in the day wore hoods at night, and there were many unsung heroes. We're not in that era at all. And there's another strong factor that I haven't heard mentioned here today, and that is that our communications technology is so advanced that now you can build your own website, you can create your own internet, you can do your own blogging. It's a whole new industry. Matter of fact, much of the media is being challenged. Its viability is under some form of assault, as the regular media, the mainstream media, doesn't have the clout that it once enjoyed. Well, I don't think that it will, and that's why I was very careful to mention the need for us to create jobs and employment right away. And the one thing that we all agree on is that when this country comes out of an economic downturn, the last thing to be affected is employment. And so unless extraordinary steps are taken, it won't happen by itself. And to me, that even requires, under these circumstances, an effort that precedes even getting to health care.
And your bill, it's a new 676. Are there new provisions from the previous years? Is there anything new added to it?
Well, we changed the name. The second thing is that we included dental and dental and one other thing. We made it more available. I think we were mental health is sorely neglected, but those were the basic changes in the bill. And notice it's 37 or 38 pages. We don't try to write all the detail into it. And what I like about what's going on here is that we aren't just passionately whipping up the people that already support the bill. We're not just talking to each other. We know where we all stand. What we're trying to do is develop that strategy of how do you reach out to a citizen who supports the Tea Party? What do you say to conservative members of Congress who haven't been thinking about the bill? And what we are, I think, very importantly moving away from is the notion that we're going to threaten or coerce or force a member to do the right thing. That doesn't work, especially in an area, in a subject matter like this, where the health insurance companies hold most of the cards. And so we've got to come to a recalcitrant member and have a new approach. And these new approaches are being very, very systematically examined here in Portland, Oregon. The waivers will probably come easier in the Senate because it is still democratically controlled. We're going to have a very difficult time getting those waivers in the House of Representatives when we are 25 members short. And I don't have a strategy for that yet. So we're following Senator Sanders' lead in the Senate as to how the House strategy is developed. And I have to say, to Bernie Sanders' credit, he's been consistent when he was a member of Congress as he is as a senator, because he was a proud and important co-sponsor of H.R. 676 when he was in the House.
Obama back in the early 90s actually came out in support of single-payer health care. And now, he didn't even let it come to the table this time. Can you talk a little bit about that and how we can get it on his table?
Well, Obama, some of the best rhetoric in support of single payer came from then State Senator Barack Obama. And so we know that in his heart he is a single payer person. Now, what the pressures are that are mitigating and causing that silence can only be surmised from my position as that he's trying mightily to regain the strong support that he enjoyed from independents that created his victory in '08. I think that's political re-elections are the only thing I can attribute that to. But to me, as much as I want him re-elected, there's nothing that would make me back down off certain fundamental principles about a bill that I have, and a principle of healthcare I've been supporting long before he entered public life.
Where do you get this passion? You're just such a passionate advocate for this. Where does this come from?
I come out of the movement that King inspired and moved me to. I mean, King was the greatest influence in my life, politically. And when I compared the circumstances that I worked with him under, I remember we were in some city down south, and we had to turn the lights off in this church. We were having a meeting, and get down under, on the floor, underneath the seats in the church, because we thought that they might shoot into these cars circling this church that knew of the meeting might just shoot into the church. I mean, that was their life. I was just there for that meeting. This is what they were living. And when when you know about that and experienced a little bit of it, I got one fellow out of a Mississippi prison who later came to Washington and went to law school and became a member of the bar and came in to visit me. You can't imagine how proud I was remembering how we had met in that Mississippi prison years ago.
Thank you very, very much, Representative.